In this morning's Medical Alert, May is Mental Health Awareness Month. It's a chance to better understand what millions of people all around the world are dealing with. And joining us this morning from Mount Washington Pediatric Hospital is Dr. Harper Johnston. Good morning. Thanks for coming in so early.
Thank you.
All right, so let's talk a little bit about mental health in this month. It really encompasses a lot of things.
Yes, May is Mental Health Awareness Month. And the purpose of Mental Health Awareness Month is to start a public conversation about mental health issues so that we're shifting our emphasis from mental illness, which has negative stigma attached to it, to mental health, which is actually a lifelong process of personal practice and community support.
And your focus is on youth, communication delays, ADHD, that type of thing. It's changed over the years, would you say?
Yes, absolutely. It has changed. I remember a time when a child with autism might have a meltdown and parents would print out business cards that would say, "You've just come in contact with a child with autism. For more information, dial 1-800, because we didn't have the internet. And people didn't know what it was. So most of the children were misunderstood. And in some ways, they're still misunderstood, but the awareness is more, which is what May is about.
I see, and we need that awareness.
Yes.
You say there's some barriers. A lot of people are afraid to get help because of the stigma attached to it.
Yes, absolutely. So people are so afraid of making mistakes and admitting to their mistakes that they don't seek help when they need it. So what I do with the children is we'll write down their mistakes in pencil, and we'll say mistakes are very valuable, because we're coming at it from a positive approach at Mount Washington Pediatric Hospital. And I'll ask them, what did you learn from their mistake? And once they can tell me that and come up with a plan, then they get to erase it with my giant prop eraser, which says, name it, don't shame it. And it works also with parents who like to learn from their mistakes as well.
And the bell here, another prop you've brought.
Exactly. The number one problem, if I could distill the difference between mental illness and mental health, it's that moment when you feel the panic and you decide whether or not you are going to ring an alarm and give in to the panic, or whether or not you are going to ring a service bell and ask for help. So I actually keep a service bell in my office, and I teach the children when they start to feel that panic that they can ask for help, and they associate the ding with learning how to cope.
I see. What advice would you give to parents, especially that you work with children?
So my advice would be to focus on your child's strengths, because when you have a child that has a diagnosis especially, the strengths are hidden in between the symptoms. And it's just as important to treat the symptoms as it is to cultivate the strengths, find out what your child is interested in, and work with that and try to build your relationship so that you're connected with your child wherever they're at. If they speak, if they don't speak, if they have behavioral challenges, they're really just trying to cope with not having a skill yet. So we want to treat the missing skill and develop a support system, because there are no bad kids, just misunderstood kids.
Dr. Harper, really quickly, where can folks get a hold of you?
At Mount Washington Pediatric Hospital.
Okay, perfect. Thank you so much for coming in.
Thank you very much.